It's time for a frank and scientific talk about something many older men wonder about, but rarely discuss: masturbation. If you're an older man who masturbates, you might have privately questioned if it's truly healthy after 50 or 60, or if you're causing unseen harm. If so, you're not alone. This topic is surrounded by confusion, old myths, and a distinct lack of clear, reliable information. It's one of the most common yet unspoken concerns for men in their mature years, and it's easy to see why there's so much uncertainty. Studies show that while most men over 60 continue to practice self-pleasure, many do so without knowing the real effects on their hormones, prostate, or even their performance with a partner. That's why we're having this honest, science-based conversation today. We'll explore some surprising benefits and crucial potential risks, ensuring your practice is a healthy one. Let's start with the good news. Masturbation offers several surprising benefits for older men. First, it helps maintain penile health. The act of getting an erection increases blood flow to the penis's spongy tissues, acting like physical therapy. This regular exercise keeps tissue elastic, which is vital for achieving and keeping firm erections as you age. Second, it promotes prostate health. Many large studies, including a major one from Harvard University, have linked more frequent ejaculation to a significantly lower risk of prostate cancer. The idea is that regular ejaculation helps flush out potentially harmful substances from the prostate ducts. Third, it strengthens your pelvic floor. The rhythmic contractions during orgasm engage key pelvic floor muscles. A strong pelvic floor is crucial for erectile function, ejaculatory control, and preventing urinary incontinence, a common issue for aging men. Fourth, it reduces the stress hormone cortisol. In our high-stress world, this is an incredible built-in benefit. Research shows orgasm significantly drops cortisol levels. Lower cortisol helps regulate blood pressure and reduce anxiety, making it a natural tool for heart and mental well-being. Fifth, it releases a cocktail of feel-good neurochemicals. Orgasm fills the brain with dopamine, the pleasure molecule, and oxytocin, often called the bonding hormone. This natural mood booster provides a sense of well-being and emotional connection, invaluable for mental health. Sixth, masturbation aids in the self-detection of physical issues. Regular self-pleasure makes you intimately familiar with your own anatomy. This self-examination is one of the most effective ways men discover early signs of conditions like testicular cancer, penile fibrosis, or other anomalies that might otherwise go unnoticed. Seventh, it improves sleep quality. After orgasm, the release of hormones like oxytocin and prolactin, along with the reduction in cortisol, creates a powerful sedative effect. This helps the body relax deeply, making it easier to fall into a restorative deep sleep, which often becomes more challenging with age. Eighth, it enhances overall pelvic blood circulation. Beyond just the penis, masturbation improves blood flow throughout the entire pelvic region. This is good for the health of the bladder, prostate, and surrounding muscles, preventing issues related to stagnation and poor circulation. Ninth, it can serve as a training method for ejaculatory control. For men who struggle with premature ejaculation, masturbation provides a safe, private space to practice techniques like the stop-start method. This helps you better understand your body's signals and build greater control, which can then translate to partnered sex. And 10th, it keeps your sexual desire and neural pathways active. The brain is the largest sex organ. By regularly engaging in sexual fantasy and physical stimulation, you keep the neural circuits tied to desire and arousal firing. This helps maintain a healthy libido and sexual responsiveness, even if you don't have a regular partner. But for a complete picture, we can't just focus on the positives. A healthy practice is a conscious practice. So now, let's talk about the potential risks or negative effects you need to watch out for. The first risk is social isolation. This becomes a problem when self-pleasure stops being part of a healthy sexual life and instead becomes a substitute for real human connection. The solution here is awareness. Make sure this practice complements your life, not allows you to withdraw from it. Second is the risk of skin microlesions. This usually happens when masturbation is too aggressive or done without enough lubrication. These tiny tears can cause irritation, inflammation, and even lead to infection. The fix is simple. Always be gentle and use a quality water-based lubricant. Third is desensitization. If you stimulate yourself the exact same way, with the same pressure and rhythm every time, your brain can become conditioned to only that specific touch. This can make it hard to get aroused or reach orgasm with a partner. The key is to vary your technique, rhythm, and focus. Fourth, it can mask the underlying causes of erectile dysfunction. If you can only get an erection during masturbation, but not with a partner, it might be tempting to ignore the issue. However, this can hide serious underlying health problems like heart disease, diabetes, or hormonal imbalances. If you notice this pattern, it's essential to see a doctor. And speaking of underlying causes, it's important to pause here. While this discussion gives you the what, there's a powerful natural solution that addresses the why. There's a video presentation that many find essential viewing for any man concerned about his sexual health. It reveals a surprisingly simple 7-second home remedy developed to address what new science suggests is the real root cause of many male performance problems. This isn't about masking symptoms. It's about a 100% natural approach to restoring youthful hardness and stamina. You can find a link to this video in the pinned comment below. Please open that link in a new tab so you can watch it right after we're done here. Now that you have that resource available, it's crucial we cover the remaining risks you need to be aware of. The fifth risk is nerve compression from poor posture. Many men masturbate while sitting in a hard chair or hunched over, which can compress the pudendal nerve in the pelvis. Over time, this can lead to genital numbness or pelvic pain. The ideal is to practice in a relaxed, comfortable position, like lying down with proper support. Sixth, it can become an unhealthy emotional escape mechanism. Using masturbation as your only way to cope with stress, boredom, or frustration can create a behavioral dependency. It's crucial to have a diverse toolkit for managing your emotions, including exercise, meditation, and talking with others. Seventh is the feeling of guilt and shame. Many men were raised with powerful cultural or religious taboos about self-pleasure. If these feelings persist and cause you distress, it can be incredibly beneficial to speak with a sex-positive therapist or counselor to help reframe this natural practice in a healthier light. Eighth is pelvic congestion. While infrequent ejaculation is a risk factor for prostate issues, excessively frequent ejaculation, multiple times a day over a long period, can sometimes lead to a feeling of heaviness or aching in the testicles and pelvic area. The solution is moderation. Listen to your body's signals. Ninth is a potential impact on semen quality. This is only a concern if you and a partner are actively trying to conceive. While it doesn't harm your long-term fertility, ejaculating daily can temporarily reduce sperm concentration. For optimal quality, studies suggest an abstinence period of 2 to 5 days is best. And 10th, a disconnection from reality, often linked to pornography. If masturbation becomes heavily reliant on extreme or unrealistic pornography, it can skew your expectations and make it difficult to connect with a real-life partner. The key is to balance any visual aids with your own imagination and memories of real, effective experiences. So, as you can see, masturbation after 60 isn't simply good or bad. It's a tool, and like any tool, how you use it determines its effect. The secret ingredient is always consciousness. Practiced with awareness, respect for your body, and moderation, it can be a powerful and marvelous ally for your health and vitality. We hope this conversation was helpful. We'd genuinely like to know what you think. What was the most surprising point for you today? Leave a comment below, and let's continue this important discussion together. If you found value in this information, please give it a like and subscribe for more straightforward, well-researched advice on mature health. Don't forget to hit that notification bell so you won't miss our next conversation. Stay healthy.